The problem of type 2 diabetes can really be best understood as too much sugar in the body. So not just in the blood, but in the whole body. So if you take a drug such as insulin, and insulin is sort of a classic drug we use for type 2 diabetes, you have to ask yourself the question, so if the body has too much sugar, is that insulin getting rid of the sugar? And the answer is no. What insulin does is it takes the sugar that's in the blood and it pushes it into the liver, and the liver says, whoa, what am I going to do with it? So it turns it into fat and it sends it through the body, so you gain fat, and that sugar goes all through the body. And over time, what happens is that the body just keeps filling up with sugar. It goes in the blood, you give more insulin, you shove it in, and you keep cramming the sugar into the body. And over 10, 15 years, all the organs just basically rot. Your whole body just rots away. So you get heart attacks, you get strokes, you get kidney disease, you get blindness, you get foot infections because there's so much sugar in the tissues. All the while, if you were to check the blood, you'd say, wow, the blood is nice and clean, because you're using all this insulin to cover up the problem of too much sugar. Essentially, what you've done is you've taken that sugar and from where you could see it and put it in a place where you can't see it. So it's no different than taking the garbage in your kitchen, and instead of throwing it out, just put it under the sink. And when the sink is full, well, you put it into your bedroom and you put it into your bathroom. And they go, whoa, look how nice and clean my kitchen is. But your whole house starts to smell. And this is the same problem, because you say, over time, you say, wow, look, my blood sugar is nice and low. But you've moved it into your body. You're gaining, the patients are gaining weight, they're going blind, they're getting kidney disease and all this. All the while, the doctor pats himself on the back and says, wow, look how nice and low the blood glucose is. And that's the problem. You never corrected the original problem. In fact, all you're doing is covering it up and then pretending that things are getting better when they're actually not. And that's where we need to sort of educate people and say, look, if this is a dietary problem, if the problem is too much sugar in the body, then get rid of the sugar. And there's only two things you need to do. One, don't put more sugar in, which is a low carbohydrate diet, or burn it all off. And for that, we use a lot of intermittent fasting, and exercise is good too, but it's less effective than most people imagine. And that's great news, because if we've been all wrong about the treatment of type 2 diabetes, that means with simple education, we can actually reverse the whole tide of this sort of tsunami. It's reversible, and not only that, it's not going to require drugs. We're not going to give people more drugs. It's not going to require surgery. It's not going to require us to build out huge, giant units to do specialized things. Anybody can do it themselves for free tomorrow, just with just the knowledge that we give them. And that's the sort of promise that we hope is going to happen, is that people are going to be able to take control of this disease, because what we're doing is we're giving people the power to control this sort of obesity, type 2 diabetes, metabolic disease, rather than them getting sick and then going to their doctor and their doctor saying, well, you know, let me give you some insulin. And then a year later, oh, let me give you some more insulin. Because that's not making them better. We've tried it. We've done it for the last 15 years. It's not working. It's getting worse. So the people have to have the knowledge to take control of their own health.